Your health is your responsibility, and that duty to protect yourself is even more important during this COVID-19 pandemic. Practicing social distancing, wearing a mask, avoiding crowded spaces, and sanitizing hands are all part of your infection prevention arsenal. If you're visiting from overseas or recently returned home, please obey the 14-day quarantine rule. Adhere to the curfew hours. If you're experiencing flu-like symptoms, stay home. And if you don't have to go outside, stay home. Let's all do what we can to limit the spread of COVID-19 in Jamaica.
Elections in Jamaica are now monitored under the campaign financing legislation. Therefore, I implore all candidates, political parties and contributors to adhere to the requirements.
Candidates in an election may spend up to $15 million and registered political parties up to $630 million. Candidates, political parties and contributors who fail to disclose are guilty of an offense and liable to charges and/or a term of imprisonment.
The transparency and effectiveness of our democratic process requires you to be informed and involved.
A message from the Electoral Commission of Jamaica.
Good day, I'm Stephen McHugh, and this is your JIS News for Monday, August 31. Government has given approval for persons in quarantine to vote in the upcoming general election. The Office of the Prime Minister made the announcement in a press statement this morning. The Disaster Risk Management Order has been amended and the changes gazetted to provide the protocols for persons voting in the September 3 poll. It outlines that persons who are in quarantine but not self-isolation may leave quarantine once to vote, after which they must immediately return to quarantine. Certain safety protocols are also mandated for these and all other voters. They include wearing a mask, submitting to a temperature check before entering the polling station, washing or sanitizing of hands at all appropriate points, and maintaining social distance of 6 feet from other persons. Individuals who are required to remain in quarantine, in isolation from other persons, may also go out to vote, but only during the 1-hour period of 4 p.m. to 5 p.m. on September 3. These persons must notify the Ministry of Health before leaving quarantine. In addition to the other safety protocols, they are required to travel to and from the polling station in a private vehicle in which there are no other persons except for the driver. Up to press time, there are 8 persons of interest in state quarantine, while 28,425 are quarantined at home. In the meantime, Election Day workers and members of the police and military forces went out today to cast their votes ahead of Thursday's general poll. Under the Representation of the People Act, provisions are made for these electors to vote 3 days before the rest of the population to ensure that they are available for duty on Election Day. 46,777 Special Services electors were registered with the Electoral Office of Jamaica, and voting took place between 8 a.m. and 4 p.m. This group comprises 31,084 Election Day workers, 11,512 police officers, and 4,181 soldiers. The new voting protocols for persons in quarantine also applied to these groups. The Ministry of Health and Wellness is again calling on Jamaicans to be vigilant as the country recorded another major spike in COVID-19 cases Sunday night. With another 245 new cases confirmed, Jamaica has now recorded 2,357 COVID-19 infections. 1,374 of those are active cases. While recoveries remain at 890 persons, a total of 21 individuals have now died as a result of the disease. The Ministry of Health's August 30 update shows new infections in every parish, with Kingston and St. Andrew along with St. Catherine leading the way. A significant number of new COVID-19 cases were also confirmed for St. James, St. Thomas, Portland, St. Anne, Clarendon, and Manchester. As the number of new cases continue to increase, the Health Ministry is reminding persons to follow the infection prevention and control measures to guard against the spread of COVID-19. These include frequent washing of hands with soap and water, maintaining the prescribed 6 feet physical distance from others, and wearing a mask when in public. Visitors and returning residents are reminded that they must comply with quarantine orders. Meanwhile, the country's healthcare workers are being reassured that the Ministry of Health and Wellness is making every effort to ensure their safety with adequate personal protective equipment, PPEs. Chief Medical Officer Dr. Jacqueline Bisesa-McKenzie says PPEs for healthcare workers are being sourced weekly.
The Ministry of Health is making every effort to ensure that we have adequate number of personal protective equipment. We understand that you need to have these personal protective equipment. We are operating in the face of global shortages, and our procurement teams are on the job every single day trying to ensure that every week we get in supplies.
The CMO was speaking at the ministry's most recent virtual COVID Conversations press briefing. She expressed empathy with the healthcare workers who are feeling vulnerable due to the increasing number of COVID-19 cases and hospitalizations, including persons who test positive after turning up at hospitals for other ailments. She's urging healthcare workers to be vigilant in securing their own safety.
We are asking that persons ensure that they use the personal protective equipment that is available consistently, and that they consider that every possible patient could be COVID infected. We also have to consider the possibility that our colleagues may also be infected, and so therefore, we must also be consistent in the use of the personal protective equipment when we relate to one another.
And finally, primary schools across the island will be given a total of $50 million to purchase tablets for needy students. Minister of Education, Youth and Information, Carl Samuda, says the tablets will be provided to students who are in need but are not beneficiaries of the Program of Advancement through Health and Education PATH. He says that given the disruptions caused by COVID-19, the provision of these additional tablets will ensure that more vulnerable students have the tools to fully participate in the blended learning approach that must now be adopted. Students at the secondary level who are not on PATH will also be supported. The Education Ministry has already procured 40,000 tablets. Another 60,000 tablets and laptops are being sourced centrally and at selected schools for students on PATH. These devices will be distributed on a phased basis beginning in September. And that's it for JIS News Today. I'm Stephen McHugh. Thanks for watching.
Jamaica Social Investment Fund, JSIF, celebrating over 20 years of investment in community development. JSIF has forged relationships with international funding partners as well as private and public sector entities. Let us continue to invest to reduce vulnerabilities. Let us build our social capital and resilient infrastructures to ensure full participation in Vision 2030. JSIF, investing for community development.
The government has been ramping up its delivery of water supply to citizens in recent times. In addition to providing households, farms and businesses with the commodity, schools have been featured in the mix. Take a look.
Access to potable water is an essential ingredient to quality of life.
And so we are working to implement the immediate measures to give as much relief as possible. And our long-term goal is to develop a diversified and more resilient system. So all Jamaicans that are within our utility service will get consistent delivery of water.
While government is putting the necessary infrastructure in place to bring water to the people, it is also ensuring that conservation is at the heart of those efforts. And what better way to ensure that Jamaicans value their water resources than through the young? We cannot always build a future for our youth, but we can always build our youth for the future. That quote echoes perfectly the mission of the Ministry of Economic Growth and Job Creation's Water IQ or WIKI initiative. It's aimed at changing the ways Jamaicans use water by targeting the future of our nation, our young. The ministry focuses on children from primary and high schools across the island, training them to play an active role in water conservation. And of course, it doesn't hurt to improve the water usage of schools, which are among the largest consumers of the commodity.
And he's supposed to drink about 1 liter of water.
Under the Water IQ program, 12 students and a teacher are chosen from a target school. The teacher and the students are taught proper water management practices and techniques. Training is conducted by agencies within the ministry, including the Water Resources Authority, the National Water Commission, and the Rural Water Supply Limited.
Water. My name is Rowan King. So what is the last water reading? 4 gallons per minute.
Do you know how much water you're supposed to drink for the day? Alright, let me see. 8 glasses.
So we're going to use lake and river as the same. Right, so if see right here, if it says that, you find your way over to river, if it says lake, and you take up one, wait if somebody is there, roll the line, put on one.
We learn to tell children to build their water IQ, conserve water, not waste it, because in the future we will need it.
My role is to teach them how to conserve water and show them how to do it and not to waste water. And if I see a leak around the school, I should report it.
When they are wasting the water, I come down, I turn off the pipe, I tell them to go to their class.
In my home, I've also introduced it to my mother and my brothers, also my sisters, that conserving water is very important. We should use small amounts when bathing. We should ensure that we turn off the faucets while brushing our teeth or even shaving. The water that is left after we have cooked or anything, we can use it to water our plants.
Once training is complete, the students are assigned as water monitors and the teachers coordinate activities for the school.
They are the ones who are leading the charge in helping the students to conserve water. And you know that when students are leading, they respond to their peers even more than adults. And so these water monitors, not only are they going to perform their tasks at school, but they are going to perform their task in the homes and in the community.
The WIKI program is very good. We like that it is really something that empowers the children. They're in charge of something.
Even as children, teachers, parents, and the school community are engaged, the Rural Water Supply Limited also retrofits the schools with water harvesting and water conservation devices.
The school is saving and will continue to save.
Before, it was difficult for the students to wash their hands and flush the toilet and the chefs to cook. But now we can even wash our hands in the bathroom and the chefs can cook so we can eat lunch.
When the tanks were not installed, we had to run to the pipe and get soaking wet and come back, and in the end of the day we get sick. Now when the tanks are installed, we can use the bathroom and wash our hands and walk on the corridor to our class without getting sick.
We are very grateful. It's like we have water every day in the pipe.
So far, 41 schools have benefited from the program.
Additionally, Rural Water is in dialogue with the Ministry of Education, and we have received a listing of 182 primary schools which are in need of water supply. Funding in this regard is being sought to install rainwater harvesting solution.
If you leave it to me, Mr. Kemoy Lindsay, and the team at the Ministry of Economic Growth and Job Creation, No school no left without the Wiki initiative.
Thank you for the tank, rural water. I am sure it will make life much better when there is a drought and time get dry. No water, not the puppy don't need to cry. Cow have 2 tanks to a water like bunk, but we still not go waste water monitors in place.
You too can join the water conservation and efficiency movement right there in your homes. Invest in water-saving devices. Check for leaks and fix them promptly. Reuse water where possible. And just be mindful of your treatment of this precious commodity.
Water is life. Rural water supply is on a mission to save the nation. Life. Water is life.
Find out where you are to vote by calling the EOJ or checking the EOJ website. Remember to bring your voter ID card. Current voter ID cards are valid until December 2020. Remember, you may still vote without your ID card, but the process will be longer. Listen to the instructions of the presiding officer. Mark your ballot behind the voting booth and return your ballot to the presiding officer folded. Once the counterfoil is removed, your ballot cannot be traced back to you. Dip your finger in the ink and watch as your ballot is deposited into the ballot box.
Your vote is your voice. Make it count.
Here's what you need to know if you're desirous of coming to Jamaica.
Jamaica's borders are slowly reopening, and I know for many like myself, it couldn't be a happier time. From March 21 to June 15, many of us were unable to be in physical contact with our family and friends overseas. We know why. COVID-19 caused our borders to close. Yes, COVID-19 is still around, but fortunately for us, the government has put in place several measures to allow our peeps to come home and others to visit. So if you want to know the procedure on how to come to Jamaica, hassle-free of course, stick around. The first step is to apply under the Controlled Entry Program. There are 2 portals, one for residents and another for non-residents. If you're a Jamaican resident, visit jamcovid19.moh.gov.jm. There's also an app that you can download and complete the application from there. If you're a non-resident, go to visitjamaica.com. This is a run-through of the portals for the not-so-techno-savvy people. The information I'm going to share is the same on both portals, so don't worry, you can follow. Alright, so you can go to any search engine, whether Google, Safari, Mozilla, Yahoo, whichever one you have, and then you type in visitjamaica.com. On the screen, you'll see Get a Travel Authorization. Click on Apply for yours here. It will then go to a new page that asks, do you live in Jamaica? Yes or no? You click on the one that's applicable to you. Once you do that, you'll come to a page that asks for an email address so a one-time password can be sent. And then you fill out the form, name, date of birth, passport number, address, the works. You'll also be asked to answer questions related to your exposure to COVID-19 and your current health condition. If you're a Jamaican resident, you'll be asked questions to verify whether or not your home is suitable for a mandatory 14-day quarantine period. And guys, if your house isn't right for home quarantine, you don't have to worry. The government has facilities that will accommodate you. After you complete and submit the form, review will take place. The Ministry of Health and Wellness and the Passport, Immigration and Citizenship Agency will do the review and approval process. From what my friends and family have told me, the length of time from submission to approval is just a few days. So once you've been approved to enter the island, you're issued a digital travel authorization. Remember, this certificate is a MUST. You cannot check in on flights or board ships coming to Jamaica if you don't have the certificate. You've gotten your digital certificate, you've booked your passage, and now you're on Jamaican soil. What's next? The first set of people you'll see once you've landed or docked is a team from the Ministry of Health and Wellness. They will carry out a preliminary health screening. After that, you'll be taken to the immigration hall for another screening, which will include a risk assessment. You'll also be tested for COVID-19. If you are from a country within the travel bubble, you'll only be screened. That is a temperature check, observation of symptoms, and a health risk assessment. What's the travel bubble, you may ask? These are a group of countries which pose the lowest risk of spreading the coronavirus. These countries include Antigua and Barbuda, St. Vincent and the Grenadines, Trinidad and Tobago, Barbados, the Cayman Islands, Montserrat, Grenada, St. Kitts and Nevis, St. Lucia, and the Turks and Caicos Islands. So now you've passed the screening. Next up is registration. You'll be asked to provide your address information so it can be recorded and tracked through either your phone or a wristband. This information will be monitored by the security forces. So if there are any breaches to the mandatory 14-day quarantine rule, there will be trouble. As usual, you'll be responsible for your own transportation unless you are being quarantined at a government facility. For visitors to our shores, they should follow the COVID resilient corridor, which runs from Negril to Port Antonio along the north coast of the island. And there you have it, an easy breezy return to the rock. And guys, before I go, I want to encourage you to continue to practice your regular sanitization. Wear your mask when in public. Wash your hands regularly with soap and water. Use sanitizer with at least 62% alcohol base and avoid touching your mouth, eyes, or nose. For health's sake, let's protect ourselves and our loved ones.
If you're having any travel authorization related challenge, call 888-786-2703, 876-656-9307, or 876-542-6007. Find out how you can keep your children safe from poisoning in the home.
Limiting our household's risk to COVID-19 has increased our storage and use of certain products, which may be harmful when misused. Disinfectants such as bleach, rubbing alcohol, vinegar, and hand sanitizers, though used increasingly to protect against the novel coronavirus COVID-19, can cause poisoning. So too the misuse of medication, dish soap and laundry detergent, toilet and drain cleaners, polishes and waxes, all-purpose cleaners, insect sprays, as well as shampoos and conditioners, nail polish and nail polish removers, makeup and lotions. Once you've used sanitizers such as bleach, store in a cupboard with a lock. If items are discarded in the bin, take out the garbage promptly as fumes may build. Children should always be supervised when using soap and hand sanitizers. If you've used cleaners to sanitize children's toys, be sure to let them air dry before they are returned, and keep cleansers in their original bottles, not in food containers. Never mix household cleaners as they can cause noxious fumes. When using certain chemicals such as bleach, turn on the fan. Open doors and windows to aerate the area. And be sure to wear gloves, long-sleeve shirts, long pants, socks and shoes when using certain chemicals such as pesticides. Improper use of prescription and over-the-counter medication, multivitamins and other pharmaceuticals could result in organ damage or death. It's especially important to properly store these and other potentially harmful substances away from children's reach. Store medication in a chest. Don't share prescription medication. Never take more than the recommended dose of medication. Before administering medication, properly read labels. Store medication in its original container, and be sure to dispose unused and expired prescription drugs. A member of your household may be suffering from poisoning if he or she has burns or redness around the mouth and lips or along the hands and legs, smells of chemicals, has difficulty breathing, nausea, diarrhea or vomiting, is experiencing drowsiness or confusion, dizziness, blurred vision or headache, as well as rapid heart rate or low blood pressure. If you see these symptoms, call the police 119 numbers or the Caribbean Poison Information Network at 876-537-5564. When you make contact, be sure to have the age and sex of the person, the poison taken, and the symptoms the person is exhibiting. While you wait for help to arrive, here are some tips you can use. If the poison has been ingested, remove anything that's still in the victim's mouth. Don't induce vomiting or give the victim a drink or food unless told to do so by emergency responders. For eyes which have come in contact with poison, open and close eyes while rinsing with low-pressure water for at least 15 minutes. Victims of inhaled poison should be taken to get fresh air immediately. And those who've been exposed to poisoning on the skin, remove contaminated clothing and rinse skin for at least 15 minutes. We know these are trying times, and with children being at home throughout the day, their curious nature is increased and they go exploring. That's why it's important that as a family, we are extremely vigilant in ensuring our children are properly supervised and cleaners and medicine are stored out of their reach.
Create, design, share, and win prizes with your art in the Office of Disaster Preparedness and Emergency Management ODPEM Digital Poster Competition. Posters must be titled and themed Hurricane Preparedness. The competition opens August 13 and closes September 4. To enter, you must be a student between 12 and 18 years old. For more information on contest guidelines, visit our social media pages, website, or just give us a call. It's ODPEM's Digital Poster Competition.
That's all the time we have left for you on this station. Be sure to join us again tomorrow for another information-packed program. We are available 24/7, 365 online. Visit our website, our YouTube channel, or social media pages and download our mobile app. On behalf of the entire team here at the JIS, I'm Adrian Atkinson. Thanks for watching.
This has been a production of the Jamaica Information Service, the voice of Jamaica.